you to wear this on your face. It's for the greater good. We need you to wear 2 of these on your face. It's for the greater good. We need you to inject this into your body. It's for the greater good.
The general population knows and don't know they are used as an experiment continuously. You are weak, and you know who the enemy is. The enemy of humanity, the elite of our world.
You're afraid of us. You're afraid of change. I don't know the future. Mind control, revolution, take its toll. If we could, I think a switch and open your third eye. It's either we should never be afraid to die. Rise up and take the power back. It's time a fat cat's had a heart attack. You know that their time's coming to an end. We have to unify and watch our flag ascend.
Nobody will be safe if not everybody is vaccinated.
So this is urgent, and it's going to require incredible collaboration. It's going to have to go to 7 billion people.
We will shut you down.
Don't think you can get on a plane or a train.
This is a pandemic of the unvaccinated.
And we will take you to jail.
We've got to get them vaccinated.
Or we will keep you in a facility longer.
Alyssa, this really is the calm before the storm.
Not again. No.
Check.
It's after receiving the shot. One nurse took questions from reporters and then fainted.
I'm sorry.
Remarkably, a bunch of young, healthy people in Hollywood started experiencing things like face paralysis and brain clots.
Experts say more and more younger women are suffering from strokes. And now former NCIS actress Pauley Perrette just revealed she had a massive stroke 1 year ago.
It's the 1 year anniversary since I had a stroke.
We're getting word that Bronny James, who is going to be a freshman basketball player at USC, suffered cardiac arrest while at a practice.
The athletes passing out on the field, news anchors collapsing on live TV, and young and healthy music stars passing out and experiencing all kinds of weird stuff.
ABC News confirming Grammy-winning singer Tori Kelly rushed to the hospital after collapsing while out with friends. She passed out at dinner after her heart began beating rapidly.
Gatekeepers and the powers that be put on the pressure of censorship to make it almost impossible to talk about these things without getting penalized for it.
I've been excluded on Oprah, you know.
On Oprah?
On Oprah, yeah, I've been excluded.
Greetings, boosted citizens. We are anonymous. We are not Jesus. Nor do we have Alzheimer's. Expect us. Fear is the name of the game that is used to manipulate society. Shall we start with Rockefeller Lockstep 2010 as we continue to show you the lies? Are you getting ready for the next lockdown? Shall you submit or show the next generation what courage looks like?
In 2010, the deep state had the Rockefeller Foundation script a plan to introduce martial law and a permanent method for total control of the citizenry. In this plan that they disguised as an academic scenario, as they called it, the method they would use to gain complete prison-like control of the entire population was to infect them with a devastating biological pandemic, and then, under the guise of protecting us from this threat, they would be free to implement their final solution, a prison state.
आज रात 12 बजे से संपूर्ण देश में.
So together, and with the rest of the world, we face this unprecedented challenge. For many, young and old, 2020 will be the toughest year of our lives.
Breaking news, the president declaring a national emergency.
The new stay-at-home order.
We will shut you down.
Don't think you can get on a plane or a train.
This is a pandemic of the unvaccinated.
And we will take you to jail.
We've got to get them vaccinated.
Or we will keep you in a facility longer.
As the world was descending into synchronized tyranny, I began to ask myself, how did they get everyone to go along with this?
Oh, it feels so good. I know.
On Capitol Hill today, the nation's leading infectious disease expert issuing this dire warning.
It is 10 times more lethal than the seasonal flu. I think that's something that people can get their arms around and understand.
Dr. Anthony Fauci telling lawmakers that the virus will continue to spread, but how bad it gets will depend on how governments respond.
Randomized placebo-controlled trial comparing the Gilead drug remdesivir with a placebo. The data shows that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery. This is really quite important for a number of reasons, and I'll give you the data. It's highly significant. If you look at the time to recovery being shorter in the remdesivir arm, it was 11 days compared to 15 days. The mortality rate trended towards being better in the sense of less deaths in the remdesivir group.
We're seeing that within 3 to 5 days, we're seeing acute kidney failure because the virus, we assume, is attacking the kidneys. And this is when the storm happened for me. When I opened the website, Anthony Fauci was declaring that there's this new drug that is mandated in all hospitals and used by all medical doctors in America called remdesivir, and it is the only treatment to be used in all hospitals in America, only to find out remdesivir was never FDA approved to be safe or efficacious for any disease. In that study, there was 4 drugs, remdesivir and National Institutes of Health experimental drug that Fauci put in, not remdesivir, but a second one, and then 2 other experimental antibodies. In the study, at 6 months of this 1-year study, the safety board for the study found remdesivir had the highest death rate of all 4 experimental drugs and pulled the drug from the study. It didn't even make it to the end of the study because it was so deadly. Well, the second study that he quoted on NIH's website, which was the cohort study by Gilead, it actually published its findings within 28 days of giving these 53 COVID-19 patients from 3 countries. They figured out what the side effects were. 22% of all 53 patients that had COVID-19 experienced these 4 lethal side effects: multiple organ failure, acute kidney failure, septic shock, and hypotension. So did Anthony Fauci know about remdesivir's death? Oh, you better believe it. And now he was going to push this on the masses?
What's different now, Dr. Lugman says, is multi-organ failure in some patients.
They go on the vent, their kidneys fail, they go into shock, their cardiovascular system's failing, they got other infections, but we're also learning how to deal with it.
He tells me treatments like convalescent plasma and remdesivir have helped save critically ill patients.
All that has to be done is to put puppets in power to push agendas. Are you paying attention yet? Or excited for the 9th booster and free donut? Daily Mail reported that it has uncovered documents showing that none other than Dr. Evil Anthony Fauci's National Institute of Allergy and Infectious Disease, NIAID, gave $3.7 million to scientists at the Wuhan lab at the center of coronavirus leak scrutiny in 2015.
So the lab in Wuhan was unsafe. That was obvious to Americans visiting there 2 years ago. And because of the practices there, the Chinese may have unleashed a global pandemic on the rest of us. Here's something remarkable and upsetting. The work in that lab, including its research into disease-carrying bats, was funded in part by U.S. taxpayers through the National Institutes of Health.
the NIH gives this $3.7 million grant to the Wuhan Institute of Virology. They then advertise that they need coronavirus researchers. Following that, coronavirus erupts in Wuhan. And then what's really troubling to me is that either conspicuously or miraculously, the Wuhan Institute of Virology is able to sequence the virus on January 2nd, but China doesn't admit to the virus existing to January 9th, and then the Wuhan Institute of Virology doesn't release this important scientific information to the world until January 12th. So at best, Americans are funding people who are lying to us, and at worst, we're funding people who we knew had problems handling pathogens, who then birthed a monster virus onto the world.
The federal grant-funded experiments on bats from the caves where the virus is believed to have originated.
Please, thank you, Mr. President. U.S. intelligence is saying this week that the coronavirus likely came from a level 4 lab in Wuhan. There's also another report that the NIH, under the Obama administration in 2015, gave that lab $3.7 million in a grant. Why would the U.S. give a grant like that to China?
The Obama administration gave them a grant of $3.7 million. I've been hearing about that. And we've instructed that if any grants are going to that area, we're looking at it literally about an hour ago and also early in the morning. We will end that grant very quickly.
April 3rd, 2015. YouTube. TED Predictive Programming with Dr. Evil Bill Gates and the Next Outbreak.
When I was a kid, the disaster we worried about most was a nuclear war. Today, the greatest risk of global catastrophe doesn't look like this. Instead, it looks like this.
It looks like this.
If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war.
Evil many Gates foresees experiments alarmed scientists around the world who complained. According to a December 2017 New York Times. These researchers risk creating a monster germ that could escape the lab and seed a pandemic. Dr. Mark Lipsitch of the Harvard School of Public Health's Communicable Disease Center told the Times that Dr. Fauci's NIAID experiments have given us some modest scientific knowledge and done almost nothing to improve our preparedness for pandemic, and yet risked creating an accidental pandemics. After this Daily Mail article was published, CNN reports that an intelligence official familiar with the government analysis said a theory U.S. intelligence officials are investigating is that the virus originated in a laboratory in Wuhan, China.
U.S. intelligence community is working to try and find the origins of the coronavirus. CNN says that the U.S. is looking into reports that the virus started in a Chinese research lab.
January 22, 2019 BusinessInsider.com articles and videos were being pushed on social media platforms before the COVID outbreak. Dr. Evil stated, "The next deadly disease that will cause a global pandemic is coming," Bill Gates said on Friday at a discussion of epidemics.
I think an epidemic, either naturally caused or intentionally caused, is the most likely thing to cause, say, 10 million excess deaths. So the paradigmatic examples are smallpox for an intentionally caused thing, that there was a simulation called Dark Winter that didn't come out very well, i.e. smallpox scored 1 and humanity scored 0. Flu epidemics, where we always talk about the potential recurrence of a 1917 like Spanish flu problem.
Gates presented a simulation by the Institute for Disease Modeling that found that a new flu like the one that killed 50 million people in the 1918 pandemic would now most likely kill 30 million people within 6 months. And the disease that next takes us by surprise is likely to be one we see for the first time at the start of an outbreak, like what happened recently with SARS and MERS viruses. November 4, 2019 Event 201. The Johns Hopkins Center for Health Security, in partnership with the World Economic Forum and the Bill and Melinda Gates Foundation, hosted Event 201, a high-level pandemic exercise, on October 18, 2019, in New York.
Healthy-looking pigs, months, perhaps years ago. A new coronavirus spread silently within herds. Gradually, farmers started getting sick. Infected people got a respiratory illness with symptoms ranging from mild flu-like signs to severe pneumonia. The sickest required intensive care. Many died. Experts agree, unless it is quickly controlled, it could lead to a severe pandemic, an outbreak that circles the globe and affects people everywhere.
May 15, 2020. The reported coronavirus deaths in the United States, according to New York Times reporting, are of nursing home residents or workers. Nursing homes accounted for a majority of deaths in heavily hit states like New Jersey, 52%, Massachusetts, 59%, Pennsylvania, 66%, and Connecticut, 55%, and for 80% of the deaths in otherwise likely hit Minnesota.
I want to shed light on a situation that was completely preventable. About 2 weeks ago, Congressman Steve Scalise opened an investigation into COVID-related deaths that occurred at nursing homes and long-term care facilities. So what happened? In 5 states, New York, New Jersey, Pennsylvania, Michigan, and California, which are all ran by Democrat governors, they went against federal guidelines and mandated that nursing homes and long-term care facilities had to take in COVID-19 positive patients, as well as patients assumed to be infected with COVID-19. And as early as mid-April, we saw that the data was crystal clear and that the older populations were more at risk to die from COVID-19. And in fact, after that happened, Pennsylvania Healthcare Director Rachel Levine removed her own mother from a long-term care facility, while that option was not available for the rest of us.
Nationally, the CDC stated that of all deaths, only 6% were from the result of COVID alone. The other 94% had 2 to 3 other serious conditions along with COVID. The latest numbers from the CDC reveal hospitals have been counting patients who died from serious pre-existing conditions as COVID-19 deaths. Counts over 51,000 patients who actually died from heart attacks, as opposed to the coronavirus.
Hospitals have been counting patients who died from serious pre-existing conditions as COVID-19 deaths.
The Centers for Disease Control have updated their death counts for coronavirus and reveal yet again that COVID-19 is rarely the actual cause of death among coronavirus patients. According to the CDC themselves, of the 220,000 deaths attributed to the coronavirus, 87,000 of them died from pneumonia and influenza. Another 17,000 died from chronic respiratory diseases, and 26,000 died from respiratory distress syndrome. 44,000 patients died from hypertensive diseases, 23,000 died from heart disease, and a whopping 28,000 died from cardiac arrest and heart failure. Yet all of these, even patients who died from heart attacks, were marked down as dying from the coronavirus.
Nobody will be safe if not everybody is vaccinated.
That's how we're going to end this pandemic.
Ladies and gentlemen, this case is about a long-planned agenda of a group of ultra-rich people and their financial mafia based in the city of London and on Wall Street to use a pseudo-pandemic as the guise behind which, while our attention is on the pandemic, they want to complete their decades-long efforts to gain full and complete control over all of us. There are numerous platforms on which this group has been meeting and discussing this agenda, but the most important one is that of the World Economic Forum, which was invented in 1971 by a then 33-year-old Klaus Schwab. Its members are 1,000 global corporations with at least $5 billion in annual sales, politicians, media representatives, scientists, and other so-called high-profile personality. They meet once a year in Davos, but there are other such meetings, for example, in China.
What it is.
The Matrix is everywhere. It is all around us. Even now, in this very room. You can see it when you look out your window or when you turn on your television. You can feel it when you go to work, when you go to church, when you pay your taxes. It is the world that has been pulled over your eyes to blind you from the truth. What truth? That you are a slave, Neo. Like everyone else, you were born into bondage, born into a prison that you cannot smell or taste or touch. A prison for your mind. Unfortunately, no one can be told what the Matrix is. You have to see it for yourself. This is your last chance. After this, there is no turning back. You take the blue pill. The story ends. You wake up in your bed and believe whatever you want to believe. You take the red pill. You stay in Wonderland. And I show you how deep the rabbit hole goes. Remember, all I'm offering is the truth, nothing more.